In late July last year, the Ministry of Health confirmed an Mpox outbreak with 2 cases in Kasese originating from the Democratic Republic of Congo. Since then, Uganda has been battling the outbreak and many other districts have registered cases. So far, Uganda has recorded more than 3,500 cumulative cases across more than 80 districts, with 67 districts still experiencing active transmission. While many patients have recovered, 29 individuals, including children, have succumbed to the disease. Most of these occurred among those with weakened immune systems and those who sought medical attention too late.
We believe since from then, we had transmission in Mayuge and Amuru, more or less simultaneously. But it was from Mayuge that we had seeding into Nakasongola. So when the disease got to Nakasongola, it penetrated 2 communities, a fishing community and commercial sex workers. But we also know that commercial sex workers in this country move from one place to the other. A number of cases per day, every 24 hours, we are seeing between 50 to around 70.
The most affected districts include Kampala, Wakiso, Nakasongola, and Mbarara. Mpox is a viral disease closely related to smallpox, which was eradicated 40 years ago. According to the Ministry of Health, Mpox initially presents with general and non-specific symptoms such as body weakness, fever, and muscle aches, lasting 3 to 4 days. Dr. Chobe explains that the early phase of Mpox is often missed by patients, but the later stages are more severe. The disease progresses with skin lesions that start as redness.
Subsequently, they start erupting, they have pus, and there are different crops of these. They can be in any part of the body. And for some individuals who have lesions in the private parts, you have extensive burning sensation, pain, and in these individuals you may have severe disease which may later culminate in secondary infection, and then subsequently you may have what we call a blood infection.
Mpox spreads through close contact with an infected person, including skin-to-skin contact, such as touching or sexual activity. The virus can also spread through contaminated objects like clothing or beddings. Health officials warn that people with multiple sexual partners, including commercial sex workers, are at high risk of contracting Mpox. The outbreak in Uganda has been largely driven by sexual activity among these groups and those with multiple sexual partners.
And in the months of October, November, December, and parts of January, it was largely concentrated amongst commercial sex workers and a few border individuals, actually mainly border individuals, and then individuals that work in a vibanda, individuals that work in a commercial or commuter taxi drivers. But now, of late, we've started seeing the disease appearing in individuals of higher socio-economic status.
The most affected age group is between 18 and 49 years. As one of the ways to curb the outbreak, Uganda will receive an additional 100,000 vaccine doses, which is a donation, as the 10,000 doses received earlier this year have already been used in areas of Kampala, Kawempe, Makinde, and Nakawa, among others.
Vaccines used before for smallpox, because they are sisters. Smallpox and Mpox are sisters. So the vaccine for Mpox, for smallpox, has cross protection for Mpox because they're related viruses. And actually the vaccine that we are using, which we have, MBV, was initially a smallpox vaccine, not a new vaccine. It has been around forever. And of course that speaks to the aspects of safety, that it's known, it's been tested before.
Nobat Atkunda, NTV Weekend Edition.